joining us for Beyond the Nest about open enrollment. John Novi, that's Georgie, and Alex Cheser will be presenting tonight. So I will hand it off to John and Alex.
Well, thank you. Welcome to this year's open enrollment presentation with Bluebird. And I just wanted to introduce myself. I am John Novi with the Cosmat Insurance Agency. We 40 years in the business, brokering mostly employer health plans as well as individual plans, which takes us to our open enrollment that begins November 1st. So for those of you on this Zoom meeting, I'm assuming that you either don't have coverage for your child, or you have coverage for your child under an employer plan that is not sufficient enough for your caseload, for your care plan, with either a hard limit where you have specific amount of visits available to you, and then you are out of pocket after that, or a soft limit, where it is appealable based on medical necessity, but that is a challenge between provider and insurance carrier. So that's where we step in. If you don't have coverage or need better coverage, we've got a great solution, and we've been offering it now for several years. And that is a Blue Cross Blue Shield Preferred Bronze plan. It's part of the Affordable Care Act, which means you've got state mandated benefits. Mandated benefits mean unlimited behavioral health therapies, including speech, OT, PT, ABA, etc. So that is literally unlimited for the calendar year. So you can use it as often as it's needed to be used and billed for. It is the Blue Cross Blue Shield Bronze PPO 302 plan currently. That is for 2023. We do not have the plan numbers for 2024 currently. However, once they are available, we'll be able to share them with you. Obviously, we'll have them available by November 1st, but we don't have them currently. So I'm going to go off of the 2023, the current plan, and thank you for putting that up. And basically, you've got, I highlighted the important parts to this, and that is the plan name, plan number, and the coverage period. This is January 1st through December 31st of this year. But if we slide down right in the middle, this is your target out of pocket. Your out of pocket is what you will pay during the plan year. Once that $7,000 is met, the plan pays 100% thereafter. So if you meet it at the end of January, based on your care plan, the plan will pay 100% of your therapies for the remainder of the year. So that's the number that you need to keep in the back of your mind, is that, okay, I've got the cost of the plan, and that is currently approximately $300, depending on your zip code, regardless of age, but it's about $300 for the kids, and it depends on the zip code. But that's your monthly premium. And then you've got an out-of-pocket maximum of $7,000. And Alex will explain this a little bit later, or unless you want to take it now, as far as how that $7,000 is spread out for budgeting purposes for the families.
Yeah. So we are an intensive billing clinic because we have services that are between 4 to 8 hours a day, 5 days a week. So the way insurance applies this $7,000, it applies it in the first few months of the year. So that deductible is $6,350 of the $7,000. We are participating as a network for Blue Cross Blue Shield, so you'll meet that deductible typically within the first month of services, and then typically 1 to 2 months after that deductible is met, you'll accrue the co-insurance until you hit that $7,000, and then insurance kicks in 100% the rest of the year. A lot of providers will charge you that full bill once it comes back from insurance to you and expect you to pay it within 30 days. That's sort of the standard medical bill turnaround. But we have payment plans that make it more affordable for our families. And I'll get more into that in a little bit. But the important thing is that due to our intensity of services for our clients, most of our families are meeting this individual out-of-pocket number within the first 2 to 4 months of services.
Okay, thank you. So 7,000 is your stop loss, basically your out-of-pocket maximum for this plan. In return, you get unlimited behavioral health therapies, including the OT, PT, speech, ABA. In addition to that, this is a bona fide health plan. Okay, so don't just think it's for Bluebird, but Bluebird does accept it. This is also a regular health plan. So if your child goes to the ER or goes for additional therapies elsewhere, or has other needs elsewhere, medically speaking, and that provider accepts this coverage, okay, and we'll go through who's in network and who may not be, all of that goes towards your $7,000 maximum out of pocket. So what I typically recommend is maybe quarterly, because medical billing kind of lags behind, and by the time they bill and by the time it gets processed, you get an explanation of benefits sent to you. It could be a month or so, but maybe on a quarterly basis, check in with Alex and see what other what other limits you have met already towards that 7,000, because then perhaps there can be an adjustment through for the remainder of the 7,000. So I'm not sure how it works on your end, but it's cumulative. It's just not Bluebird. It's anywhere you go that accepts this card for services will go towards that $7,000 maximum out of pocket. So I guess that's the silver lining, is that it's not 7,000 of Bluebird plus whatever else you use at the ER, etc. So it's total $7,000. Okay. That's the plan. Open enrollment opens November 1st and it goes through January 15th. Anything after December 15th will automatically kick in to a February 1st effective date. So be mindful of when we need to get these plans started. Enrollment takes approximately 15 minutes. The only information that you'll need to have with you that you may not know by heart is your child's social security number, and then your billing, your checking routing account number, credit card number, etc. Everything else you know by heart. It's a pretty simple process once the gates open, and that'll be November 1st. You can reach out to me. I will give you my phone number now, and you can also get it through Bluebird along with my email address. It's 847-630-1443. Again, my number is 847-630-1443. My email is John, John, at Cosmat, COSMAT.com. If you have any questions, we will spend as much time necessary explaining the plan to you, along with getting you enrolled. Once we get you enrolled, your ID card will come to you via mail, the plastic card that is, within 10 business days. Once you receive your card, your child will have their own member ID number, and at that point, you can reach back out to Bluebird and perhaps start scheduling some therapies for after the new year. They will go ahead and take your member ID number, verify your coverages are in place, and then set you up on a payment plan for the maximum out of pocket, and in addition to any other services that you receive from Bluebird, such as a food plan or nap time or whatever it might be. That's not covered by the insurance, but that'll be all worked out through the billing. Okay. I am available today for any questions after our meeting. If you have them during our meeting, you can, I think there's a chat, you can shoot some questions out, be more than happy to address them. What I wanted to do next is go through the network that is a value added, I would say, for anybody. Obviously, you're getting this because you need services at Bluebird and they accept the insurance gladly. But in addition to that, if we can get the hospital list up, Alex, this is the Blue Choice Network. It is Blue Cross's smaller network. It's not as inclusive as their large network is. However, depending on your geographic area, you may find that you're already going to these hospitals, and perhaps you can dig a little deeper and find out if your doctor is part of the Blue Cross Blue Choice Network. So these are the hospitals that, and they're I believe they're in geographical or zip code order. They're not in alphabetical, that's for sure. The very first page, there's an index. It gives it to you in alphabetical order, and you've got all the Northwestern hospitals, whether it's in McHenry, Lake Forest, or downtown. So that's pretty good to start out with. Northwestern, you got all the North Shore hospitals that are on the north side and northwest suburbs, and then there are other hospitals that are in there depending on your geographic area. You can check it out, and hopefully you find something. And again, if you can find that this plan suits your needs with not only Bluebird, but any other doctors that your child is affiliated with, this is a great option for you to meet that $7,000 quicker, right? And once you hit the 7, you're done, and you've got unlimited health insurance benefits for the remainder of the year. Another strategy that we discuss when families call in is, if this is your only child on your employer's health plan, there are no siblings. It's just you're paying family rates. You've got one child on the plan, and now you've got this Blue Cross plan in effect. At that point, you could drop to employee spouse and remove your child from the employer plan. And that way it'll offset some of your expenses because you won't be paying family rates through your employer. You'll be just paying employee spouse or employee only if that's the case. However, if you'd like to keep Rush or any of the advocates, which are not part of this network, or Children's Lurie, they're not part of the network. If you want to keep those hospitals available to you, you may make the decision, hey, I'm just going to keep both, and then the Blue Cross plan will be primary and your employer plan would become secondary. So it's completely up to you. I just like to bring that up. If there's an only child on your current plan, that you do have the option to remove that child, and just go solo with the Blue Cross plan. So it's just a cost saving kind of strategy, and we can go through that in detail.
John, I have a question.
Once we enroll.
I thought the insurance companies pick if it's primary or secondary.
Well, the way I understand the billing, and we don't get involved in it, is that if the child is a dependent, the child's primary insurance is the Blue Cross because they're the only one on the plan. If they're a dependent, it becomes secondary. If you find that it's different, then you can bill primary or secondary, whichever way you want to. The bottom line is that once you hit the 7,000, you hit the 7,000. And they may ask, is there other insurance in place? Some families have Medicaid. You can keep that. You don't have to give it up. And that's a great option for hospitals. They pay 100%, but not all doctors accept Medicaid. So I guess you can pick and choose when you want to use the Blue Cross plan, but generally speaking, and I say generally speaking because your billing may be different than how the insurance companies accept it, but the primary plan is the child's primary plan, not as a dependent.
Okay, thank you.
Mm-hmm. Any questions?
One mom asked, if they're already in a plan, will it just carry over in 2024?
If they're currently on a Blue Cross choice PPO plan that they may have gotten last year or this year, yes. as long as you pay the premium, your plan is month to month. The Blue Cross will bill you through your checking account, the $300 a month for the premium. You don't have to renew it. If you're on a gold plan or silver plan, call me. We can downgrade you to a bronze plan. And I say downgrade, it's actually an upgrade for you because the gold and silver plans have higher out-of-pockets and higher premiums. So what we try to do is find the lowest cost plan out of pocket, which is bronze, highest deductible, but it also has the lowest $7,000 max out of pocket. Now, next year, it may change slightly, but as far as we know now, it's going to be right around that $7,000 mark. So if anybody has a gold plan thinking that you've got a better plan, the bronze plan is actually cheaper, less expensive for you to carry month to month. The plans are month to month, so you don't need to do anything further. Just continue paying the premium.
I have a question about that, if I may.
Sure.
Two questions, actually. Are there any higher level plans, even if they cost more or have higher out-of-pocket max, that have both the Merlin, Bluebird in-network and the higher level of hospitals in-network, like the Advocate hospitals? Or
meaning you get all the hospitals, a large network, and you get the Bluebird services that you need.
Exactly.
And the answer is yes, but only through an employer.
Oh, okay. Yeah.
Those are employer platform plans that have that large network. And then basically, if you're an employer under 150, your employer has Blue Cross, chances are you already have an Affordable Care Act plan in place that has these benefits. Once you go over the 150 mark, they're larger employers. It's a different platform. They're not, they don't have to abide by the Affordable Care Act rules, and therefore they have the hard stops and the soft stops as far as the plans are.
Okay, so there's none of the Affordable Care Act plans, because my employer went away from Blue Cross and has United Healthcare. They started that last year, so or this year. So we're paying for both, and I was just wondering if there was one that we could get and stop shopping on the marketplace. Sure. That would do both.
So there is one exception. If you have a business in your own name and you have payroll in your, some people have second, I don't know, you dabble in something else on the side. You've got an LLC set up. You've got a couple of employees. If you have an existing corporation or LLC, sole proprietorship, that has payroll on it, and at least one other employee, you can't have a single employee on the plan without waiving the other part-timer. We can get into that. You can start your own group employer plan, if that makes sense. You qualify for it as long as we have all the documentation in place. That could be a great alternative for you. And then you'd hop off the larger employer group that your spouse or you may be on, and you just keep it for yourself. And that's a plan that you also pay month to month. You control it. They can't cancel it. And as long as you meet their criteria, there's got to be at least 2 people on the payroll, and one of those people can waive coverages. So if husband and wife are both on payroll, that works. Or if you've got a part-timer or a 1099er, we just did one today with that, it works out. So if you have a bona fide corporation, LLC, we could probably work around that and satisfy your needs.
Okay, I'll reach out. And then another question I remember from last year, possibly, I think from this call, there was something about if you do have you have an employer plan and you have this plan, and this one has an out-of-pocket of $7,000 and the other one has out-of-pocket of say $8,000, that this total would be say $15,000 out-of-pocket total for both if you went to both and used that many services. But I thought there was something about that it would actually be less than that they somehow, both plans together, it becomes out less for the out-of-pocket max, but I haven't really been seeing that. I'm curious if I'm misremembering that.
Alex,
No, we do talk about that, and I have a slide where I'll go over that once I get to my portion of the presentation and sort of how those combined policies work together.
Okay,
It's
because I
called
have
cord-
not see that happening, so that's what I'm curious how to make that happen.
So from our standpoint, it's called coordination of benefits, but
Mhm.
let's say you use Bluebird and you max out at 7,000, but then you use the other plan, your employer plan, and you're going to Lurie's or you're going to
Mhm.
Rush or somewhere that's out of network, that could trigger another out of pocket because it would be it's not in network with Blue Cross. So it depends on how you're using it and where you're using it, I would think. But if you're in network, once you hit the 7,000, you're done.
No, yeah, I get that. I'm just curious about that other situation where you're actually accessing both with 2 out-of-pocket maximums. I'll wait for the other part of the presentation if that's going to come up.
Yeah,
about how
and
that
I'll
can
remember
be
your
less.
example. Yeah,
Okay.
I'll remember your the numbers you threw out and sort of walk through that once I get there as well.
I appreciate it.
Yeah. Were there any additional questions for John? I can work into the Bluebird side of things, and we can have a larger Q&A at the end, unless anyone had any immediate questions about signing up during open enrollment.
Can I just ask a quick question? So my brother is eligible for Medicaid, so he's not, so if that's the case and he's not eligible for the marketplace, am I correct?
no, you can't have both.
No, you can do both.
Yeah, John said you could have both. Sorry.
Medicaid may ask you if there's other insurance already in place. I don't believe they have a question, do you intend to purchase additional insurance? Because they assume that you can't afford it if you're on Medicaid, but it doesn't prevent you from getting it. And once that happens, then they'll coordinate benefits between Medicaid and Blue Cross. And in that situation, I'm not really sure who's going to be billed as primary because the child will have their own all kids or whatever it's called. There's Meridian, there's all kids. There's a few different names for Medicaid, unless he's a dependent on your brother's plan.
So I know that we can have both Medicaid and a private health insurance plan, but I'm not sure if we can have both Medicaid and a plan from the marketplace.
Yeah, so when you say the marketplace, you're saying you're trying to apply for subsidy. Am I assuming correctly? Where they assist you with your monthly premium?
I think the question is, can she sign up for this private plan through the marketplace, the healthcare.gov marketplace? And I think yes, because this is, even though it's through the Affordable Care Act, it is considered a private plan that would
Yeah,
not.
so right. So Obamacare, Affordable Care Act, marketplace, they're synonymous, right? So as your broker, we would ask questions, and one of the questions is that if you feel that you qualify for subsidy, that is assistance in making that $300 premium payment, you can apply through the marketplace. They will ask you all kinds of financial questions, so you want to have your tax return handy. They go by household income. And you just look at, they'll ask you what's on line 12, what's on line, so you just go down your tax return, you plug in the numbers, kind of like applying for financial aid for school. And then there's a threshold. So if you're, depending on the size of your household, if you're single, I want to say you're in the high 40,000s. And once you hit that threshold, you phase out of subsidy. The closer you get to that benchmark, the less you get. But as long as you're over the poverty level, which I believe is 15,000 or so, if you're right in between that, you'll get some level of subsidy to help you offset your premium. That's where I would encourage people to go if they feel that they qualify. If you don't qualify, then there's no point in going there. Just call us directly. You're signing up for the same plan. It doesn't cost any more to go through us. At least you have representation instead of just an 800 number.
Okay, so the bottom line is if we have Medicaid, if we currently have Medicaid, we should keep it so that we could keep seeing the larger hospitals like Advocate and Lurie Children's. But
Yeah.
this 302 so we can have services at Bluebird Day. Is that the plan?
You're exactly right. And
Okay.
as long as you continue to redetermine, each year you have to redetermine your Medicaid qualifications based on your income. As long as you can keep it, but
Okay.
if you ever lost it, you've got the Blue Cross plan to fall back on.
Okay, cool. Thanks, John.
Yeah. Mm-hmm.
And just to expand on that before I jump into my portion of the presentation, we as Bluebird or Merlin, we are not credentialed to bill Medicaid, and so we will only be operating with that one Blue Cross Blue Shield plan through John's agency or through healthcare.gov, wherever you obtain it. We will only be billing that one because we are just not able, because we're not contracted with the Medicaid sort of government agency to be able to bill that. So there should be no worry about overlap between those two policies if you do have a Medicaid plan. So,
but it's a great secondary plan to have in the event you go to those hospitals you mentioned earlier, for sure.
right. Thank you so much, John. And then we will also have more questions and answer portion at the end of the call so that you can take John's presentation and what I'm about to go through together. We can both answer questions at the end. But my goal for this is to make sure you understand as much as you can quickly about how our billing works, how much it costs for the services, both things through insurance and both our monthly fees that don't get billed through insurance, how that accrues, the payment plans, and just sort of general insurance literacy and things to look for. So we're going to go through some vocabulary because people often get the terms mixed up and confused a little bit because it's all a lot of technical jargon. We've already touched on this, but how the out-of-pocket max accrues through our services, how we bill and create payment plans, scenarios where you might have a primary and secondary policy, as well as the concierge admin services that we provide, and an additional resource that we can send you if you'd like. Basic insurance vocabulary. Most people probably know a good portion of these already, but I just like to outline it so everyone can get on the same page. The premium is what you're paying for access to that policy each month. So that's the $300 something depending on your zip code and income that John was talking about. Through your employer, typically you're sharing that premium. Usually, the employer pays 50% or 80% depending on where you are, and you pay the other portion. That is your monthly sort of access to the policy. The deductible is the amount that you have to pay before insurance start paying on claims. So you have to sort of buy in a little bit before insurance will kick in. That's just the sort of structure of how these policies are set up. So on the example that John had, you would have to pay $6,350 in claims before insurance started paying on the claims. Co-insurance.
I'm sorry to interrupt, but are you advancing your slides? Because I'm still seeing slide number 1.
Oh, I was. Let me. So sorry. Can you see the overview slide now?
No.
One moment. So sorry.
You had it before though.
Okay, something about the presentation mode messed it up, so I'll just share in this mode and go through the slides that way. So we're
Perfect.
progressing in real time. Apologize about that. The vocabulary. Yes, so the deductible is the portion that you have to pay before insurance kicks in. Then once insurance is paying on a portion of the claim, it's either a co-insurance rate, which is a percentage. Oftentimes we'll see that once you've met the deductible, insurance is paying 80 to 90% of the claim, and then you're responsible for that other 10 to 20%. A copay is a set amount, $20, $35, $50, depending on the service. That's just a set amount that you pay. All of these things together, the deductible, the coinsurance, and the copay, build up towards the out-of-pocket maximum. So just as John was saying, that is really the number that you want to be focusing on, because due to our intensive services, that is the amount of money that you'll meet and that you'll need a budget for the year. Once you meet that $7,000, insurance will kick in 100%. So with this policy, with the $7,000, I've been at Bluebird since January 2020. You're probably going to hit that $7,000 sometime in February. And then that means that all the therapies the rest of the year through December will be paid 100% by insurance. So the value that you get, the amount of therapy that you have access to is quite great, that you're able to get 5-day-a-week therapy for that out-of-pocket amount. Patient responsibility, you'll hear us use this term. That's just sort of the catch-all term for everything that you pay, whether it's deductible, coinsurance, copay. It is all considered your portion of the responsibility through the insurance plan. Some other things, billed rate versus agreed rate. Essentially, it's the sticker price for a healthcare service, and then the contract price that insurance will pay. Don't worry about this too much. Just know that we might say that we bill insurance for a service that's out of pocket would be $160, but insurance is only paying $100 for that particular service, and it's that $100 service that builds up towards the deductible and out-of-pocket max. But again, that's just sort of a nerdy sort of detail. If you just want to focus on the out-of-pocket max, that'll be the thing that is central to your payment plan. Coordination of benefits. If you do have multiple policies, you do have to call in to each policy and establish that coordination of benefits so that each policy knows about the other one. If you don't do that, we've had parents that try to skirt around it. They will find each other, and then what will happen is they will take all the money that they've paid us back, and then we have to send in documentation showing what the other policy paid for the other one. So it's really important that if you do have a primary and secondary policy, that you establish that. Something that we have to look for in policies, which is not a concern with the policy that John was talking about, are soft maxes and hard maxes. A soft max, usually see this on occupational, physical, and speech therapy services. A soft max, once you hit that, we as a provider can send in documentation requesting more visits. Sometimes if your child has a particular diagnosis, it'll waive that soft max and we won't have to worry about it. But a soft max is something that we can work with. Now, if you're looking at your policy and you're looking at the portion about OT, PT, and speech, and there's language about a hard max, unfortunately, we are not able to do anything with a hard max. That is, a set in stone max, unless your child has an autism diagnosis, in which case that may supersede it. But for the most part, the hard max is a barrier on a policy, typically through some of those employer policies that we unfortunately can't do anything about, and it's just a reality of the policy. So the out-of-pocket accrual, we are billing and this is that sticker rate, not necessarily the amount that insurance counts, but that sort of build rate sticker cost of services. We are billing about $2,000 a week to insurance with our preschool and kindy program. They're both 4-hour programs of rotations for our different services. If your child has a individual services on top of that, depending on their recommendations, those individual therapies are billed at $160 an hour. So that deductible typically met within the first 2 to 4 weeks of the year. Then the co-insurance and copays will kick in until you meet that out-of-pocket max. And across all of our policies that we've had, they typically meet that out-of-pocket max within the first 2 to 5 months of the year. So our billing process, what does it look like? In January, our admin team is calling to verify benefits for every single client. We have over 160 clients between our 3 locations. It's a lot of time on hold. It's a lot of time on the phone, but we want to make sure that there are no surprises for your policy, and that if there is, that we can intervene and try to do something sooner rather than you being surprised later in the year with a roadblock. So we call to make sure that there's no barriers or limitations or maximums that would prevent us from, serving your child for the full year. And then we will send out what we call a cost breakdown payment plan. This takes that, in John's case, that $7,000 and splits it over the course of the year. And you can choose a payment plan between 3 and 11 months, and that would start in February. So we would be charging you for those insurance claims over the course of the year, rather than asking that you pay that $7,000 within the first, John mentioned there is a little bit of a lag time between us billing a claim and getting it back from insurance in our system. But still, we don't want to ask you to pay that $7,000, within the first, 4 months of the year once we get all the claims back. So it is an interest-free payment plan. We do it because, we want our families to have the convenience of, being able to spread that out and, get these services for their children. The cost breakdown payment plan is just related to the insurance portion, and our monthly fees, which I'll go over, are on top of that. We have some things that, are just internal services that we're not able to bill to insurance. They're not included in that out-of-pocket max figure. So using this policy, say that you're, thinking about joining Bluebird, you want a policy that starts January 1st, what would that look like? So for the total cost of that first year of services, you would have the $7,000 of that out-of-pocket maximum that we would split over 11 months, which would be $636.36 a month. Now, if you get other services elsewhere that chip into that $7,000, you may not owe that full $7,000 to us. We are only charging you what we get back from insurance. So, if your child has to go to the hospital, has a big bill, you may end up owing us less for the year. But say you met everything with us, that's how that would break out over the 11-month payment plan from February to December. The monthly lunch fee, which is a required part of our program, our speech language pathologists are administering different foods, different textures, focusing on safe swallowing techniques, which is a concern for a lot of our clientele that has developmental delays and may have some need there. That's $125 a month. If your child has more than 5 hours of services, we are legally required to give them a rest period. It doesn't necessarily mean they're taking a nap. It just means that for a lot of kids, they are taking a nap, especially the little ones. But it's just unstructured time that is monitored by our therapeutic assistants for, play, rest, that sort of thing. So that is $250 a month. If you're joining our program, the deposit fee during enrollment is $500, and the annual registration fee is $150. So the total for the first year services is between $9,000 and $12,150, and that's everything. And we want to be transparent. about what that anticipated cost is for the year. It depends, if you have that rest fee or not, if you're getting that full day of services and require a rest period. But that is the total cost for the year of services for that first year. You pay the deposit registration during enrollment. During January, we're only going to be charging you either the lunch or the lunch and rest fee, depending, because we are calling and verifying those benefits and setting up those payment plans. If you just had 4 to 5 hours of services per day, that payment plan from February to December would be $761.36 a month. If you added on the lunch period, it would be the $1,011.36 a month. The length of your daily schedule for services does not impact the insurance portion. So you accessing more services, it's not going to cost more from insurance. That out-of-pocket max is the number that it is for the year. And with our intensive services, we're going to hit it eventually or not. The only thing that changes when you extend your child's schedule is that rest fee. That's the only thing that would be added in addition to your monthly bill. Primary and secondary policies. As I said, you must call and establish that coordination of benefits. I know that it's not fun calling insurance. I can tell you from experience, member services is a little more friendly and timely than the provider side. So you just be calling both, letting them know about the other coverage. Typically, if the child is on the marketplace policy by itself, as John mentioned, since that's their policy and their name, that would be the primary. And then if you had an employer policy, that would be secondary, since the child would be a dependent. Now, the biggest misconception is that you will have, a big cost savings between the two. In our experience of having several clients with secondary policies over the years, the total amount owed ends up being somewhere in the middle between the two. So you're definitely paying the out-of-pocket max for that first primary policy. So you'd be paying that $7,000. And then if the other policy had a larger out-of-pocket max, say it was an out-of-network policy, that's $10,000, there may be some additional patient responsibility. We, as an organization, if the primary policy has paid the claim in full, and the secondary policy puts a copay on it, we're not forwarding that copay to you because we've considered that service to be paid in full. Other providers, may forward out-of-network copays to you. We do not do that as an organization. An example of a real client that we had in 2021, they had a $1,000 out-of-pocket max for a primary policy and a $2,700 out-of-pocket max for the secondary policy. After claims processed through both policies, they were both Blue Cross Blue Shield policies, just to be clear for this example. The total cost for the family for the year, for just the insurance portion, not the lunch and rest and everything, but just the insurance portion, was $1,912.18 instead of $3,700. So unfortunately, we are not able to give you a hard estimate of what it will exactly be, but typically it's going to be somewhere between the primary policy and the two of them added together. So, but with a marketplace plan, as long as everything's paying 100%, even if the secondary policy does apply a copay, we're not necessarily forwarding that to you. It just depends on how the claims process. And it's really important for you to establish that coordination of benefits to do so. For the example where we had the $7,000 and an $8,000, you might end up paying, definitely $7,000. Hopefully your total cost would not exceed the $8,000. Most policies consider a portion of the copay paid for one policy is satisfying towards the other one as well. It really just depends. So in that scenario, I would budget $8,000 for the year, anticipating it being somewhere in that ballpark. So there's not necessarily a huge cost savings to having the secondary policy. So if you don't have other children, and you want to get this specific policy for your child, and then just have yourself or your spouse on your employer policy, that may be worth it. The things to ask are like the coverage, and making sure the coverage extends for everything that your child needs. So the primary marketplace, as long as the hospitals you want to go to, your primary care physician, any specialists, as long as everyone is in that primary marketplace plan, that sort of blue choice network, then that's really the only policy that you need, and you can sort of rest assured that it'll cover everything. If your child's doctor is out of network, that may be the sort of argument for you to keep both policies, but it's not necessarily something you have to do. And I just want to reiterate that it doesn't necessarily deliver a huge savings at the end of the year. It just means that your services will be covered for your child between the two of them. In terms of like what we do and the additional sort of concierge service that we offer at Bluebird, we're calling and verifying those benefits, getting those reference numbers to make sure that what they quote us is what happens through the rest of the year. Anything that requires a pre-authorization, or if we need to appeal for more visits, if there's a soft max, that will be handled by us. We'll dispute all your claims. If you have on your policy to get sent everything in the mail, you're going to be getting a lot of mail. So I encourage our families to, log on and just like click electronic delivery for your explanation of benefits or your EOBs. Because, we're billing services every single day. So you're going to get a lot of mail if you don't do that. But don't panic. Don't panic. We're handling everything internally, and we're seeing it just as you're seeing it in the mail. Anything that needs to be coordinated between your primary care physician and pediatrician and our clinic in terms of an insurance medical record request, we are handling that as well. Our goal is to sort of take that administrative load of an intensive health billing situation and like just have you focus on, your relationship with your child and your relationship with our therapist, trying to take what they're learning at home or learning at the clinic back to home. We do have a guide to healthcare. John was specifically talking about our marketplace policy that is, a wonderful option for so many of our families that guarantees coverage for our intensive program. If you're trying to like figure out through your employer, or if you are approaching open enrollment through your employer and you have a few options, we are a network with Blue Cross Blue Shield PPO and Aetna PPO, as well as TRICARE PPO, if you have a TRICARE policy. That's what we're in network with. So you would focus on those in-network levels of the out-of-pocket max. United, UMR, Cigna, we are out of network with those. So you'd be looking at that out-of-network rate on the out-of-pocket max. We unfortunately do not accept HMO plans. We're just not part of those contracts with health insurance plans. The most important things that you want to look for when you're sort of ascertaining these other policies, again, this is not a concern with the marketplace policy. Those visits are unlimited. But for other policies, you want to look to see what the policy says about autism. If your child has an autism diagnosis, that diagnosis gets them a lot of extra benefits. We have a lot of clients that have policies that we normally would not be able to accept because they have a hard max, but because of their diagnosis, if it, whether it's the individual policy's choice or if they follow the Illinois state mandate for autism, that will waive the max on services. So we're able to bill those services for the whole year on a policy that normally wouldn't allow it just due to your child's diagnosis. Those maxes typically occur for speech, physical, and occupational therapy. Those are the roadblocks that we typically see. very seldom do we have a roadblock when it comes to psychotherapy that our social workers administer or ABA. It's those OT, PT, and speech services that you want to look for. And there's typically a section, if you're looking at the policy document, that details those specifically. And if there is a soft or hard max, like we talked about, and if you can appeal for more visits. Of course, not every child has an autism diagnosis with a developmental delay. We have a full range of children of different developments in our program and different diagnoses. So other language you can look for is language on severe mental illness, developmental delay, and or habilitative therapy. So the type of services that we're rendering is considered habilitative therapy rather than rehabilitative therapy. So those are things you can look for, especially if you get that big PDF document. You can do a Control F to search through it. If you have the document and you need help sort of deciphering it, feel free to reach out to us. We can take a look at it. We're not able to give you a 100% thumbs up or thumbs down, but we can give you what we see and then have the questions that we would want you to ask your HR or benefits manager for your organization. So those are the things we want to look for, basically just making sure there's no roadblocks to us being able to bill for services, for 5 days a week for the majority of the year. And that is how billing works. Bluebird. So now we'll reopen the floor for questions. If you have anything about Bluebird and our billing for me or for John and I collectively about insurance.
Maggie has a question. Is the 302 plan the best plan for children with autism?
Yes, absolutely. Let me, so any of the plans that are offered, whether it's gold, silver, or bronze, as long as it's Blue Choice preferred, they all have the same benefits. It's just a question of deductible, co-pays, and maximum out of pocket. So when we look at, where am I here? I'm trying to find when we look for plans, and that's how we came to determine the 302 plan was the best. We look for the lowest cost plan with the lowest maximum out of pocket, and that translates to the 302 bronze plan. But if you have gold or silver, you still get unlimited therapies. Thank you.
Anybody else have any questions for John or Alex?
I have a question. I'm not sure if I heard it correctly. So if my husband's employer plan has a hard max on like speech, OT, PT, but my kiddo has an autism diagnosis and the plan is an Illinois mandated plan that allows the behavioral therapy. Did I understand correctly that means that would possibly mean there would not be a hard max on PT, OT, speech due to that diagnosis?
That is correct. And that is something that, I would really push you to get a clear answer from the employer's benefits manager or HR department. If they don't know, they will be able to ask the broker that they're purchasing their policy from. And you would just want to specifically get the answer, if my child has an autism diagnosis, are the maximums on occupational, physical, and speech therapy waived?
Yeah, if I can intervene real quick,
Go ahead.
I would just cut to the chase and bypass HR and the employer because you may not feel comfortable discussing it with them. But instead, just get the procedure codes from Bluebird that they're going to be billing under. And that'll also give them a diagnosis code, et cetera. Once you have the codes, right, for each therapy that your child needs, you can reach out to your claims department for that insurance carrier and ask them, hey, my child has been diagnosed with autism. These are the procedure codes. I understand I have a hard stop on the therapies. However, what do I need to do to get this reversed, appealed, etc. And at least you'll get something in writing from them, and they're the ones that actually who, you know, have the answers and hold the keys to that. In the
And
event,
really, when we check benefits, and Alex could,
Yeah.
talk about this too, that's one of the questions. Do you follow the Illinois state mandate? And if they do, it's everything. It's 100%. So if they don't, and they say there's a hard max and they don't follow it, then we can't accept that policy.
right, unless you appeal it and get it overturned, and that takes effort, and also it at the end of the day, it may not work, right?
Well,
Right.
our experience is it doesn't work, so we do not
Okay.
appeal it. We do not, unless it's soft maxes,
Right.
of course. And certainly we do a lot, our billing concierge does a lot of,
Yeah, you have more experience in
going,
that
yeah,
area.
going through the benefits and
So if you've got a hard
disputing
max
them, getting medical.
and you're looking for, then this policy through
necessity, so
Blue
we do all of
Cross,
that.
yeah, the Blue Cross policy is your solution then.
Yeah.
So to answer your question, whichever venue you feel most comfortable with, we're happy to give you those codes as well. But if you also just, make sure, hey, my child has this, if, it's nothing to be ashamed of. You're advocating for your child, whichever way you feel most comfortable for, your HR person should be able to also tell you and give you a clear-cut answer if there's maximum bone services with that particular diagnosis. And, I will clarify, just because there's coverage for behavioral therapy or applied behavioral analysis services does not necessarily mean that the policy follows the mandate. So that's where you'd want that clarification for. So just having those services covered to provide doesn't necessarily mean that there's not going to be a maximum on the OTPT and speech. But either Blue Cross Blue Shield or the HR benefits manager, depending on what you're more comfortable with, should be able to give you the answer clearly before you purchase the policy.
Okay, great. Thank you. So really it's that whether it follows that mandate, that Illinois mandate or not is the key.
Yes. This is so technical. Sometimes it won't technically say that it follows the mandate, but the individual policy provision will waive the maximum. So it could be an either or situation. We ask about the mandate because that's mostly, what policies are abiding by. But I would just ask it both ways to make sure that you're getting the full answer for, whether it's the mandate or it's just the policy group's individual choice to waive the maximums. Either way, both are fine. We just need that confirmation that there's no maximums.
Great. Thank you so much.
Of course.
Is there any plan or thought about expanding some of the insurance group plans that are accepted, like as far as UMR or United Healthcare? Is there a particular reason why those aren't accepted? Just curious.
Yeah, that is that is a question that's above my head. I deal with this sort of day-to-day billing and insurance and the sort of client-facing side of things. That is a bigger, larger business question about contracting. You'd have to sign a big insurance contract with those. As far as I know, there's no plans to expand that I've heard of. But unfortunately, I don't have a good answer about why that is, why we chose to be a network with Blue Cross Blue Shield and Aetna and TRICARE and not United or UMR Cigna. Apologize, I don't have a better answer on that.
We could investigate and talk to our directors and see if there's been any movement, or because I know it's a long process. So we could definitely, see if we can find anything out, if that's going to change in the future.
Right. And even
Thanks.
if it did, it likely it wouldn't happen in time for 2024, probably. So
Right.
Our experience as brokers is that unfortunately there aren't many choices for Illinois families. Blue Cross is the gold standard. They have been. They dominate the market share, and they are Affordable Care Act approved. So on the individual side, that's really the only game in town. Along with, I don't know of any other plan that Bluebird would accept on an individual basis that would offer you these unlimited therapies. On the employer side, you're at the mercy of your employer as to which plans they select, but as long as they're employer groups of under 150, they should be ACA approved and therefore not have the softer or hard maxes. It's when you work for the city of Chicago or large employer groups that have hundreds of employees, most of the time they're self-insured, or they do not need, they can carve out certain benefits, whether it be infertility or behavioral, or they don't have to follow the same ACA rules as the smaller group plans do.
Alex Candy Kane had a question. Are the codes the same for Bluebird and Merlin Day? To ask about what having the with having the autism diagnosis.
I cannot say 100% for sure, but from what I know, it is essentially the same. There are only so many CPT codes that OTs can bill and PTs can bill. Most of the codes should overlap, but since clients for Merlin are older and at a higher developmental stage, there might be some codes that I don't know about. But from my contact that we are sister companies, so I do interact with people at Merlin and IS billing wise. From my understanding, most of it is the same. So even if we gave you our codes that we're billing for you to check, that would be enough for you to be able to ascertain if there's any roadblocks on those particular service types for the most part. But it's also very easy to reach out if you're concerned to Merlin, and they can provide the same information from them as well.
Any other questions?
So if we're interested in enrolling in any plans, do we just email John and then we can go from there?
You can email me at john@cosmat.com or simply call me 847-630-1443. Anytime. I can't enroll you prior to November 1st, but I'm more than happy to speak to you and go through any scenarios that you might have. Either way, it'll result in a phone call to complete the enrollment. And anytime after November 1st works.
I added all your information in the chat. So
wonderful. Yeah. Great.
And I just wanted to reiterate that if you are wanting a policy that starts January 1st, you do need to purchase it prior to December 15th.
That's correct.
For it to kick in. Otherwise, we will have to wait. If you sign up February, December 16th to January 15th, you'll have to wait till February.
That's correct.
Hello, I do have one more question. Is this the best plan to pick? Is the Blue Cross and the 204 brands, or
it's a 303 bronze.
303? Okay.
Or 302. What? Hold on. It's a 302 plan. Now for 24, they may change the number of the plan. So that is what the plan is called currently. The network is going to stay the same. It's Blue Choice Preferred PPO. Plan numbers do change because they need to get filed with the state or the insurance department.
Got it. Thank you so much.
We apologize that we don't have those documents for the 2024 policies.
Yeah, they're not available.
But November 1st is very soon, so we'll be able to let you know so you can decide and budget very soon.
We don't anticipate the max out of pockets to change by much, if any. They've remained the same for the last couple of years. But whenever there's a change in the mandated Affordable Care Act benefits, the insurance companies have to file a new plan document with the state of Illinois, and therefore it changes the plan number. But again, they're still going to have a bronze plan. We just don't know what small variations there may be for 2024. But in any event, it's inclusive of
right around the corner.
Yeah, it's inclusive of unlimited behavioral health, ABA PT, OT, speech. So you're not missing anything with that.
Thank you so much.
Of
Got it.
course.
You're so welcome.
And thanks for hanging out with us for a little bit longer. Thank you, John and Alex, for the presentation. Of course,
Wonderful.
if anyone has any questions, you could reach out to any one of us and we'd be happy to help.
Yeah, email me, call me, reach out. We're here for you. And open enrollment's going to be busy. Don't wait till the last minute. That's my suggestion. Sometimes their portal gets overlogged and we get bounced out, but usually the process is about 15 minutes. Start early. They won't bill you until January 1st. So there's no downside in enrolling early.
Thank you, everyone, for coming.
Wonderful.
Thanks, John and Alex.
Thank you. Okay. Bye.
Thanks, everyone. Have a great night.
You too.